Here we are going to focus one of the most important topic for today is the pulmonary embolism. So pulmonary embolism, it is a life-threatening blockage in the pulmonary vasculature and is the most common caused by deep vein thrombosis. So pulmonary embolism occurs when a thrombus forms, most commonly in the deep vein. So when we take the history when we assessment the patient, we can see the patient started the complication from deep vein thrombosis. The client prone to pulmonary embolism are the stroke. What are the risk factors? Before to go the risk factor, let me explain something. So you see, this is the thrombus formation in the legs. So we called blood coagulation because of venous stasis. So when the thrombus formation here, and thrombus basically stationary, but it is the life-threatening. And this thrombus, when embolus formation, and embolus is mobile and result of thrombophlebitis or deep vein thrombosis. So this emboli traveling from lower extremity go to the inferior vena cava and finally enter to the heart, right atria, right ventricle. Through the pulmonary tongue, they enter inside the lungs. Inside the lungs, there are microcirculation. There are so many arteries and very small arterioles and venules. They fall in stuck and causes the blocking, and patient develop pulmonary embolism. So in this picture here, you can see a piece of a blood clot. So this is the thrombus. The thrombus is break down. A small piece is called emboli. So what are the difference between thrombus and emboli? I can explain. Thrombus is fixed, stationary, and they are life-threatening. When blood clot formation and breakdown in small pieces, we called emboli, and emboli can travel. It is mobile. So this emboli from lower extremity go through the inferior vena cava and traveling through the vein, enter inside the heart, from heart to pulmonary tongue, go to the lungs. Inside the lungs, embolus get stuck in small arterioles or small veins, and they produce the sign and symptom of the disease. What are the sign and symptom of pulmonary embolism? So in this picture, you can see patient has a dyspnea or chest pain. We call pleurotic chest pain, or patient develop tachycardia, tachypnea, or patient develop hypotension. All of this complication lead to make patient anxiety. So patient will be anxious, restlessness, and even develop the hemoptysis. So you see the blood clot start from deep vein thrombosis, then travel to the lungs. Let me read what we wrote here. Pain in inspiration, dyspnea or pleurotic friction rub, tachycardia, increase the heart rate, tachypnea, increase the respiratory rate, blood hypotension, petechiae, sweating, we call diaphoresis, all can lead to anxiety and feeling of impending doom, right? So who are under risk to develop deep vein thrombosis? What are the risk factors? At the risk for deep vein thrombosis include prolonged immobilization after major surgery, obesity, pregnancy, heart failure, advanced age, and history of thromboembolism. So if anybody prolonged bed rest, like after major surgery or immobilization, long plane ride, suppose you are going to travel by the plane for a long way, more than 8 hours, pregnancy, obesity, also congestive heart failure is a risk factor. Imagine fat emboli can occur as a complication after the fracture of the long bone can cause the pulmonary embolism. So long bone fracture, the big chance of fat tissue break down and they causes the fat emboli. Also, patient give the history of smoking, oral contraceptive, or immobilities. So treatment is aimed to prevent through the risk factor, right? And also, if we find the risk factor, we have to eliminate it. Before to go the management, I want to tell you how we diagnose it. Okay. So in this picture, you can see a simple test we can do in the patient bedside is called Homen sign. So the Homen sign, so you see this is the calf muscle, right? So these classical findings of calf pain on dorsiflexion of the foot with the knee straight. So this is the knee joint. Knee joint is straight, right? And when you put the pressure, like your one hand support the heel of the patient and another hand you put the pressure on the toes, dorsiflex. So to elicit the Homen sign, we first support the patient thigh with one hand and his foot with the other hand. And if we bend his leg slightly at the knee, I mean, we can do the dorsiflexion and also resulting the deep calf pain indicate a positive Homen sign. So when you put the pressure or dorsiflex, patient complain the calf pain and it indicates the Homan sign positive. So Homan sign is important to diagnose the deep vein thrombosis. So now, next, this is the simple test we do. Support the heel, other hand dorsiflex, and patient complain the pain. When pain in the calf muscle because of the dorsiflex, knee is straight, it indicates patient has a chance to develop the deep vein thrombosis. Homan sign is neither sensitive or nor specific, but it is the important sign. Other test we do for management of the patient, like CAT scan or laboratory study, we call D-dimer. So elevated D-dimer indicate presence of the clot. Let me read it. If there is a suspicious for pulmonary embolism, a D-dimer blood test may be prescribed, which measure one of the breakdown product of a blood clot. So elevated D-dimer indicate presence of blood clot. What are the other diagnostic tests? We can do the chest X-ray, or we can do the CBC, complete blood count. We found the thrombocytosis, or prothrombin time, partial thromboplastin time. We can do EKG or arterial blood gas analysis, right? And CAT scan or CT scan. So what are the management, or what are the nursing intervention? Nursing care. So first priority, patient, place the patient in high Fowler position and give them oxygen. So bed rest, administer oxygen, Fowler position, heparin or coumadin means anticoagulant, and thrombolytic drugs like streptokinase can help to break down the clot. So medication is the anticoagulant or thrombolytic therapy like heparin or coumadin and streptokinase, right? So keep in mind, maintain the constant intake of vitamin K while on warfarin. We encourage the patient smoking cessation and increase the mobility and also compression stroking and reduce the risks of bleeding, and no aspirin to the patient. Use electric shaver, short toothbrush, and avoid the blowing nose when they are under anticoagulant and also thrombolytic drugs. So this is very basic information we should know for pulmonary embolism.